Hello and welcome. I'm Rosa Piro and this is OBG Talk in partnership with the ABS-CBN News Channel. Today we will take a closer look at the economic landscape for the healthcare sector in the Philippines, on par with its ASEAN neighbors in terms of GDP spending on healthcare, currently at 4.7%, but lagging behind in vital statistics that measure delivery of healthcare services.
The Philippines is on par with its ASEAN neighbors in terms of GDP spending on healthcare, currently at 4.7% versus 6.5% in Thailand and 4.9% in Singapore. However, the healthcare sector is lagging behind in vital statistics that measure the delivery of healthcare services. 6 out of 10 Filipinos who succumb to sickness die without ever seeing a doctor. Filipinos face various challenges and shortages within the existing health system as demand outpaces supply. Major reasons of the growing gap are rising middle class, a national healthcare system which remains inadequate and underfunded, a high export of healthcare professionals, and shortage of beds and doctors across rural areas. This shortage creates an opportunity for the private sector to bridge the gap with the renewed interest from multinationals and foreign investors in key areas, hospitals, clinics, and health maintenance organizations.
With us today is Dr. Edwin Mercado, President of the QualiMed Health Network, a partnership between leading real estate developer Ayala Land and Mercado General Hospital. Thank you for being with us today, Dr. Mercado.
Thank you for having me, Rosa.
Let us start with the attractiveness of the healthcare market here in the Philippines for investment. So we've seen a lot of active growth in terms of mergers and acquisitions, yourself in partnership with Ayala, looking to expand the number of hospitals under the QualiMed brand, but also Metro Pacific on a buying spree, looking to acquire 12 hospitals by 2019. Vistaland also announcing plans to partner up with to enter the healthcare space through JVs. So let's look at what are the how attractive is the Philippine healthcare market, and also what are the drivers that will sustain its growth in the coming years.
It's looking like it's a crowded sector, but let's break it down into the segments that actually compose the whole ecosystem.
Right.
First, you look at the patient demographic, and then we will look at the payer and also look at the provider. For the patient, we all know we are 104 million population, mostly young. Our average age is 24 years old, so we are what we call in a demographic sweet spot. The employment rate is very high, but you look at the metrics, as you said earlier, the infant mortality rate and the maternal mortality rate is still very high. We missed on our Millennium Developmental Goals. We still have 38 births that are not attended. So really the opportunity is very high. The emerging disease is also shifting from before trauma and infection to more lifestyle diseases, which are chronic diseases.
Right.
Diabetes, hypertension, stroke. Also, the aging population is also an opportunity. We don't have yet a very solid network of nursing homes to provide elderly care and even end-of-life care. Now, looking at the provider, we're so underbedded. The bed population ratio here in the Philippines is only 1 to 10,000, which ideal is about 2 for our ASEAN peer and 5 if you base it on OECD rates. So just for us to maintain the 1 is to 10,000 bed ratio, we need to build 12,500 hospitals every year. Just to reach the ASEAN peer, you need to build 125,000. So imagine the underbedded capacity of the Philippines. Also, primary care provider is very thin, and I think that's what we need to focus on. In terms of the payer, you mentioned that our average GDP spend is now 4.7%. It's really a big growth from 2011 to 2014, about 31%. But still, the average spent per person is only $135 per person, which still pales compared to our ASEAN peers. So I guess with all these segments, opportunity is really there, but the main issue is how to make healthcare more affordable and how government will respond to be able to stretch out its benefit and offer it across the whole spectrum of lifespan and even the whole spectrum of care from primary to specialty care.
Right. And speaking on the government's role, so their ultimate goal is to attain universal coverage and also start covering the remaining 8% of the Filipinos who are currently not enrolled in PhilHealth. So what are the biggest challenges in achieving universal health coverage, and how is it possible to reach the informal sectors of the population?
Correct. PhilHealth is now up to 92%. Bulk of the funding and the growth is going to be from the sin taxes. So if you look at the sin taxes, we are exceeding our collection targets. Last year, we exceeded the collection by 19%. Just for the first quarter of this year, we're exceeding collection target by almost 33%. So that's a lot of money. The problem is not really PhilHealth extending additional coverage. I think it's more how they package their coverage.
Right.
I think what is important is for PhilHealth to be able to open some space, for example, primary care, to private sector, because we know that building capacity in government or even in private sector, just to build a hospital, will take you anywhere from 3 to 5 years. So the fastest way for government to spread out and cover more people is actually engaging private sector.
Right. And on a related note, I know some of the criticisms leveled at PhilHealth is on the breadth and depth of the coverage of services, which have resulted in very high out-of-pocket payments. I think, correct me if I'm wrong, about 50% of medical expenses are out-of-pocket. And how can primary care be incentivized in the country's healthcare system as a measure to trim down costs and also expand services?
Actually, PhilHealth on our study covers about 30% of the total healthcare spend, and the remaining 70% is covered either by a supplemental insurance or out-of-pocket payment.
Right.
The PhilHealth coverage are mostly case rate based, which is good because it's now rewarding deliverer or providers with efficiencies. The problem is it is not coordinated with private sector in terms of really evaluating the cost of each case rates or its packages. PhilHealth now is even expanding to what you call the Z package, which is covering the dreaded diseases like bypass surgeries for heart, like renal transplant, like cancer. So it's a step in the right direction. But if we can work with private sector in really coming up with packages and also identifying preferred partners, which could provide those services with predictable outcomes and predictable pricing, then I think that will work better.
Right.
Another thing is the coverage of primary care. PhilHealth is now going into Checkup 2, which is a coverage of even the outpatient services for the next of poor and the poor patients. But we think private sector, it's limited to local government units and government hospitals, but we think it can be opened up to private sector.
Right.
And there can be a private sector partnership in enrolling a finite number of PhilCare benefit member per gatekeeper, and that is more proactive in terms of treating and making sure that the patient stays well instead of the cost of actual treatment. Always the cost of prevention is lower than the cost of treatment.
Okay.
An apple a day keeps the doctor away, as they say.
Makes sense.
Yes.
And you already mentioned the important role of the private sector. In fact, also according to Department of Health, the healthcare sector, the private sector comprises about 50% of the healthcare system. So really, the hospital network is a hybrid system between public and private. So what are some of the challenges under this hybrid system and in expanding access to a broader segment of the population? And also, in what ways can the private sector bridge the gap in terms of providing healthcare?
Yes. As I mentioned earlier, for you to put up a healthcare facility from conception to actual operation, it will take you 3 to 5 years. So for PhilHealth or government for that matter, to in a short period of time to expand its coverage, it needs to partner with the private sector. So first thing probably that can be done is to do a capacity study on which areas or at least which equipment or services are available on particular areas that are provided either by the private sector or the public sector. Now, government does not need to replicate in terms of those capabilities, and can just work with private sector on agreeing on a case rate or a balanced bill with a fixed copay,
Right.
and then just measure outcome and also incentivize somehow private sector by probably giving some tax incentives or maybe additional benefits if they comply with those set metrics and if they comply with those fixed case rates and those fixed copay.
Right. Well, I have more questions for you after this break. Dr. Mercado, OBG Talk will be right back.
This week on ANC's Executive Class. At the EDSA Shangri-La, we'll seek out the secrets of Asian civilization, beginning with a taste of authentic Indian cuisine and the ancient art of yoga. We'll also enjoy the traditional hammam of the Ottoman Turks and feast at the newly opened Summer Palace Chinese restaurant. Then we'll drop in, literally, at the Sofitel Philippine Plaza for a French-themed bespoke culinary experience with a wine and cheese class capped by an elegant champagne degustation dinner. Only here on the country's original and longest-running luxury lifestyle program, ANC's Executive Class.
We reap what we sow, and we're planting lots of seeds and harvesting fresh produce in this episode of Green Living. First, we'll get to know Gardeners Tambayan, an online community where we can learn all about urban container gardening. Then we'll check out My Urban Farm, a community-shared vegetable market found in the middle of a busy village. And we'll visit Balay Gulay, another unique store that sells produce harvested from a backyard farm. Learn how we can grow our own food on Green Living, Tuesdays at 6 p.m. on ANC.
Here are the stories making news now. Sabah is an issue, the West Philippine Sea is an issue, the BBL is an issue, but every day people have to deal with crime, with drugs, and also just simply getting to school and to work.
Well, you have to enforce the law. Period.
Where and how does the corruption happen? What kind of feedback are you getting from foreign investors about how they're looking at the Philippines?
They love the Philippines.
Nancy Irlanda brings you the biggest news as it breaks on your weekend break.
The president actually singled you out and extended his hand and shook your hand. What do you make of that?
Yeah, I was surprised.
Do you feel that this Duterte magic can extend to a honeymoon longer than other presidents?
Well, I think so.
News Now, Dateline Philippines, and ANC Advisories. Only on ANC, your news channel, your partner.
The second season of Dayaw explores the ways in which we Filipinos seek to be whole and complete. We begin with how we eat, and we love to eat. We celebrate the way our home regions have developed distinct dishes and flavors. We have found unique methods of using spices and flavorings.
Even in the old days, people knew by preserving it with salt or sugar, basically that defined our panlasa.
From the grandest to the most humble, yet enduring.
Dayaw, hosted by Senator Lauren Legarda, now on its second season. Thursday, 6 p.m., only on ANC. Your news channel, your partner.
OBG Talk. Still with us today is Dr. Edwin Mercado, President of the QualiMed Health Network. Now, I also wanted to discuss, we have seen from our research that there is a rise in and advance in technological solutions to serve the rural areas. For example, teleconsults, such as via SMS or email, as well as ConsultaMed, a telephone hotline, St. Luke's MedConnect app. So I wanted to see in what ways technological advancements or other ways can the providers expand their services, and also how can tertiary level health providers try to address the imbalance in infrastructure of Metro Manila vis-a-vis the provinces.
So I think those platforms addresses several issues. Number one is the geographic distribution of medical practitioners, because they tend to be based in urban centers more in rural areas.
Right.
Definitely a system that connects them with the rural area practitioners with the medical center would benefit, both professionally and also in terms of the better care for the patients. Secondly, it's also the continuity of care. Because I mentioned earlier, when the opportunity persists, it's across all the whole lifespan of the Filipino patient, from womb to tomb. So those platforms are very important. Also, by being archipelagic in terms of our geographic layout, it's very important to have those platforms. So the platform would work also if the compensation of those primary care doctors or those rural-based doctors are also changed. As I mentioned repeatedly, I think the compensation should not be based on volume, but more on outcome of care. So that will also entice them or incentivize them to stay on in the rural areas, with the back of their assurance that there will be backup coming from tertiary centers. So like in QualiMed, we have our EMR that is cloud-based and interconnects everybody from our primary care clinics all the way to our tertiary centers, including their laboratory results and also their x-rays and their MRIs. So at least there's continuity of care, and when we send back the patient, the primary care physician is very much involved.
Okay. And speaking on human capital, the Philippines produces a very large number of healthcare workers, and in fact it's one of the major exporters of healthcare. And however, some of the rural areas, as you mentioned, are in critical healthcare worker undersupply. So what has been done in the Philippines to supply enough human capital for the growing needs of the industry? And also, how is this imbalance? How can this imbalance be addressed?
So one way of ensuring the benefits of our healthcare worker is the government passed a Magna Carta of Health. And there's also the Nursing Act and several other laws protecting other paramedical professionals. The geographic reach, as I mentioned earlier, is a factor of both accessibility of backup and also compensation of the doctor or the nurses. So once you address that, I think the geographic disparity can somehow be equalized, or at least be balanced. So the doctor right now, we have like 7 doctors for 10,000 population recorded, but the actual count is 3.5 per 10,000 or per 1,000 population. So which means the PRC data, the Philippine Regulation Commission data, half of the Filipino doctors who graduated are now working abroad. So are the nurses. So if we provide them an alternative and integration with spokes and hub or rural to urban center continuity of care, then I think we can incentivize the doctors to stay on in the rural areas. So are the nurses and the other paramedical personnel.
And another topic that I wanted to cover is actually the very high incidence that we've seen for certain diseases. For example, cardiovascular and metabolic diseases among BPO workers driven by their sedentary lifestyle, their 7-Eleven schedule, combine that with bad nutrition and smoking. So what are some of the ways in which healthcare providers have been crafting and designing specific packages to address these health and wellness issues high in the domestic agenda? And which are common, for example, among BPO workers?
Yes. This is still primary care. Primary care is not only community-based, it could also be corporate-based. We in Polymed even have our corporate health solution division that takes care of institutional clients. So a very interesting fact, for example, is the top occupational diseases before was manufacturing. Now it shifted to administration and support services. So the most often these occupational diseases are back pains, shoulder pains, hypertension, diabetes. So it reflects probably the lifestyle changes and also the stresses that are being encountered. So several packages are or several programs which are proactive, preventive are being devised, and one way is to incentivize the employee to stay healthy. Like there are programs where you put wearables that measure the number of flights of stairs they go up and down every day, the calories that they take in, and somehow reward them if they meet certain metrics. Also, the other way that some providers are doing is if your utilization goes down, then your premium goes down the subsequent year. And the savings also is shared by both the provider and the corporation. So it also gives incentive for the provider to make sure that the programs are being followed.
Right. So more on a preventive side.
Correct.
Okay. And last question that I have for you today, in terms of quality of healthcare, both the public and the private sector sometimes struggle to measure up to the Southeast Asian counterparts. So what are some of the ways that we can raise standards in the quality of healthcare within the Philippine industry?
Yes, there was a move before by the PhilHealth to classify the different hospitals based on certain benchmarks, whether you're a center of excellence or center of quality or center of patient safety, which is being coordinated with the DOH. Now they have one single licensing body or licensing team that goes and inspect the hospital, both on a startup and also on a recurring monitoring basis. So those standards are also very important. We have our Philippine Council for Accreditation of Health Operation, which is a local body that sets standards, but according to Philippine needs, because there are a lot of international accrediting body, but sometimes it pushes the cost of healthcare.
For example, the JCI accreditation?
Well, there are other accrediting bodies, but their standards are international and based usually on European, American, or Western standards. So the cost, because there are certain requirements for the facilities to comply with, and even the way you dispense, for example, your consumables, like you cannot reuse it, for example. In a Philippine setting, it may drive the cost of healthcare. But definitely there are certain segment of the market that will help, or that accreditation will help, especially our foreign-based Filipinos who have insurances, or even foreigners that can come over for healthcare here in the Philippines. If you are accredited by an international accreditation body, then you can be covered by their insurances.
Right, so also maybe looking at the medical tourism opportunity.
Correct, correct.
Thanks, Dr. Mercado, for your time, and that's today's edition of OBG Talk in partnership with the ABS-CBN News Channel. I'm Rosa Piro. Thank you for watching.